Hi, Mrs. McCombs. My name is Ramanda. I'm going to be your nurse today. I just finished washing my hands. So what brings you here today?
A general checkup.
General checkup. Has anything been going on that you've noticed that you should let me be aware of before we start the process?
No.
No? Oh, okay, perfect. So what I'm going to start with is just some vital signs, just to make sure that everything's baseline and all your vital signs are normal and in order, okay?
Okay.
All right, so this is an adult cup. It's perfect for the size of your arm. So I'm just going to put it. Sorry, it's a little cold. All right, I'm also going to bring this closer so you can have your arm just resting out part right there. Sorry. There we go. Thank you. Just gonna bring this right here. Okay. So what I'm going to do is just feel for your brachial pulse. I'm going to inflate the cuff until I feel the brachial pulse stop. Then I'm going to increase it 30 more. Put on my stethoscope and listen. (104/62). So you're good. Okay, next what I'm going to do is just take your pulse for a minimum of 15 seconds. Okay, so that's about 15 seconds. So I got about 15 beats every 15 seconds. So I'm going to multiply that by 4, and she has 60 beats per minute. I'm just going to leave my hand on her pulse while I'm taking her respirations, because normally when you let the patient know that you're going to be listening to their respirations, they start to breathe unnaturally. So what I'm going to do is just keep my hand here while I'm watching her breath. No earlier than 30 seconds. Okay, she has about 9 and 30 seconds, so I'm just going to multiply that by 2 and just give her 18 breaths per minute. Sorry. Okay, moving along, I'm going to go towards her head. Miss McCombs, I'm going to be doing an inspection of your scalp right now and your hair. Is that okay with you if I go around and touch a bit?
Mm-hmm.
All right. So just let me know if you feel any tenderness or any pain as I touch your scalp. No? Okay, so as I'm feeling, I notice that there's no indentations, there's nothing abnormal. Her scalp is nice and cephalic. What I'm going to do now is just look through her hair in a couple of sections, just part it a bit, just to make sure that there's no bugs, it's clean, the hair is nice and strong, it's not brittle, there's no scarring. Of course, if there was any bleeding or anything oozing out of her head, I would be wearing gloves. Okay, and I don't notice anything going on in her hair. Have you noticed anything lately going on with your head or your scalp? Any pain, tenderness, swelling, anything like that? Perfect. Okay, what I'm going to do is just feel for her temporal artery. It's nice with a +2 on both sides, and I'm going to move down to where her TMJ joint is. So Ms. McCombs, I'm just ask you to open and close your mouth for me. And just move your jaw from side to side. Are you noticing any pain or tenderness while you do that?
No.
Okay, perfect. What I'm going to have you do now is just clench your jaw for me. Clench it tight, tight, tight. Any pain or tenderness while you do that?
No.
Okay, perfect. Now I'm going to have you close your eyes. I'm just going to touch it. You feel that?
Mm-hmm.
Any pain or sensitivity while I do that?
No.
No? Everything's good? Okay, perfect. So we're done with the head and scalp. I'm going to move on to your eyes right now. So I'm just going to take a seat just to look and see, make sure that your eyes are symmetrical. I don't see anything in the eye. There's no foreign objects. You're not tearing up. Your conjunctiva is nice and moist. your sclera is nice and white, your irises are nice in color, your pupils are nice and symmetrical. So what I'm gonna have you do is look up for me. The conjunctiva is nice and pink. I don't see anything in it. I don't see any swelling, no redness. Is there any tenderness when I touched you just now? Perfect. Okay. Now what I'm going to do is just check for your accommodation. So I'm going to hold this pen out right here for me. I want you to look directly in front of it. And I want you to focus your eyes on the pen now. Okay, I'm just looking for the convergence of her eyes towards the pen, and that her pupils do constrict as you move the pen closer, and that both eyes do converge. I'm going to test your muscles of your eyes. This gets 6 cardinal points now. So I'm going to actually just follow the pen all the way over there, up, and then all the way to the left, up, and down. So just noting if there's any lagging in the eye muscles, if one is not moving in accordance with the next, and everything looks fine. The muscles are moving perfectly. Have you had any pain or anything while you were looking around just now? No? Okay, that's a good thing to know. Next, what I'm going to do is just notice for her pupil constriction and make sure that she has both eyes consensual pupil constriction. So I'm going to ask you to look forward for me again. I'm just going to shine a light. Okay. So what this consensual pupil constriction is that once I'm shining the light in her right eye, that her left eye also constricts the pupil, and that happened just now. So that's a good thing to know. So your eyes are working normal. All right, so what I'm gonna do now is I'm gonna use this thing right here, ophthalmoscope. Let me turn it on, make sure all the lights on. Here we go. Usually we would darken the room, but unfortunately we can't. So I'm gonna do the best that I can at this moment. So I'm going to start off at 0. What I'm going to do is use my right hand, my right eye, and I'm going to be looking into her right eye. So just look straight ahead for me, Sarah. Okay, I'm looking for her, looking at all of her blood vessels, just and the optic disc, making sure that nothing is bulging, there's no scarring or anything going on with her eye. Her blood vessels are nice and plump, they're not overly, and checking for the red reflex as well. So she has all both of those. Now I'm going to use my left hand, left eye, and look into her left eye. We're looking for the same thing. So shining the light right into her pupils, looking for the red reflex, the optic disc, and her blood vessels, noting that there aren't any swelling or bulging in the eye, and that there's no hemorrhaging going on as well. So everything looks normal, Sarah. All right, now what I'm going to have you do is we're going to do the confrontation method right now. I'm going to have you cover your left eye with your left hand for me. So I'm going to close my opposite eye, and then I'm going to hold out a finger. I want you to tell me how many numbers I'm holding out.
1.
Perfect. Now we're going to do the opposite eye.
2.
Perfect. Okay, Sarah, now I want to test your visual acuity. So what I'm going to have you do is put on your glasses. And I'm just going to walk you over to the Snellen chart, just so we can test to make sure that your eyes are working. So I'm going to have you stand on the blue square, which is 20 feet away from the Snellen chart. I'm going to have you cover your right eye with your right hand and read line 7 for me.
FELOPZD,
Line 9,
LEFODPCT,
line 10,
FDPLTCEO.
line 11.
No.
Okay. And I'm going to have you use your left hand and cover your left eye for me, and let's go to line 7 again.
FELOPZD,
Line 9,
LEFODPCT,
and line 10.
FDPLTCEO.
Okay, perfect. So we know that Sarah has 2013 vision. All right, Miss Sarah, we're going to have you, Miss McCombs, we're going to have you sit back down over there for me. All right. Okay, so we're all done with the eyes. Now I'm going to move on to your ears. the first thing I'm just gonna inspect, I'm sorry, what you just know. So that they're both symmetrical, they're in line with the eyes, they're not low set, nothing's going on with them. Are you having any pain or tenderness? There's no swelling, there's no redness, there's no excessive draining coming out from her ears. So what I'm gonna do next is take a look in her ear with the otoscope. Make sure my light's on. I'm gonna choose the correct size. And what I'm going to be doing is pulling her ear, her pinna up and back. These things suck. So I'm going to pull it up and back and take a look in. Just noting the color of the eardrum. It's nice and pearly white. There's not excessive earwax in her ear. It's nice and clean. And I'm going to do the same thing on her left side. So pull the pinna up and back. And take a good look in there. Nice and pearly white eardrum. Everything looks good. Okay, now what I'm going to do is just test your hearing. I want you to occlude your left ear for me. I'm going to whisper 3 words into your right ear, and I want you to repeat them after me.
1, 2, cat.
Perfect. Now for the right ear.
1, 5, 6.
Perfect. Now I'm going to do test bone versus conduction. Right. So we're going to do the Weber test first. So I'm going to hit the tuning fork, place it on the top of your head, and I want you to let me know where you hear it.
In both ears.
Perfect. Okay, now I'm going to do the Rhine test. I'm going to hit it again and place it behind your ear on your mastoid process. I want you to let me know when you stop hearing it.
Okay. I hear it. Okay. I hear it.
Perfect. So this just shows that air conduction is greater than bone conduction. Okay, so we're all done with the ear. I'm going to move on to the nose. So I notice that the nose is nice and symmetrical in midline. There's no deviation. Everything looks good. The 2 nostrils, the nasals are the same size, so everything looks good. There's no drainage. There's nothing coming out. There's no nosebleed, nothing that I need to be aware of. So what I'm going to do is just push her nose just a little bit in so I can open up the nasal. No, so looking in, the membrane is nice and pink. There's no polyps. There's no swelling. The septum is nice in midline. It's not deviated to one side. Now what I'm going to do is take our friendly little otoscope again, right size cap, and just take a look into your nostrils one more time. Sorry. And the other side. Oh, okay, just noting if there's any scarring, any sores. The septum is deviated and I don't notice anything of that. So everything's pretty much normal with your nose. Okay, now I'm going to move on to the mouth. So looking at her mouth now, there's no cracking, there's no sores. Everything is nice and symmetrical. Her lips are nice and pink and moist. So what I'm going to have her do now is just open your mouth for me. You can use a tongue blade. Okay, what I'm doing is just taking a look at her buccal membranes. It's nice and pink. There's no sores. It's just nice and pink. Nothing's wrong with it. She has all of her teeth in her mouth. There's no teeth missing. Her tongue is nice and midline. There's no sores or anything like that. Also taking a note at her uvula, her soft and hard palate. Everything looks normal there as well. Okay, Sarah, what I'm going to have you do is stick out your tongue as far as you can and say ah for me. I'm going to look in one more time.
Ah.
Okay, perfect. Why I had her saying ah is because I want to make sure that her uvula raises as well as her soft palate when she says ah. That means that everything's working normally there. Also taking note of her gingiva. There's no bleeding, there's no redness on her gum line, as well as her tonsils. They're nice and pink. There's no signs of inflammation or any infection, no whitening of the tonsil area, which is good. So now I'm going to test some cranial nerves. So what I want you to do is smile for me. Frown. Puff out your cheeks. I'm going to have you stick your tongue into each cheek. So, perfect. Show me your teeth. Perfect. And what I want you to do lastly is just close your eyes as tight as you can. Perfect. Okay, just protrude your tongue for me. Perfect. Okay, seems to be all your cranial nerves are working fine right now. So I'm just going to pause right here, and then we'll continue with your assessment in 1 second, okay? Okay, Sarah, my name is Melissa. I'm going to continue your assessment. I'm going to, I already finished washing my hands, and we're going to go ahead and start and continue on with the cranial nerve of the gag reflex. I'm going to have you open up your tongue. Okay, very good. And we're going to continue on with the inspection of the neck. I'm going to go ahead and look at your neck. I'm going to stand from behind. And assess the neck. If you can tilt your head back down a little bit, thank you. And look for any masses, asymmetry, or any nodules or anything like that, and everything looks fine there. We're going to continue on to inspect in the front here with the auricular lymph nodes, going to the post-auricular lymph nodes, working my way down to the submental and the subclavicular. Noting for any swelling or tumors or masses. Then we're going to go ahead and look at the trachea. I'm going to have you tilt your head up a little bit. Thank you. We're going to look and see for any deviation, any visible tumors or abnormalities. I'm going to go palpate one side of the trachea and on the other side. Okay, then we're going to go ahead and inspect the thyroid. I'm going to locate the cricoid, and under it is the thyroid. I'm going to palpate for any masses or inflammation. And I'm going to go ahead and place my hands on the and I'm going to have you swallow. Very good. And I don't feel any masses. Any painful swallowing?
No.
Okay, from the thyroid, we're going to go ahead and move on to the shoulders. For the cranial nerve 11, I'm going to ask you to shrug against my hands. Very good. And turn your face one way and to the other. I'm going to check your range of motion by asking you to place your hands up against your shoulders, slowly putting your hands down to behind your neck, and then behind your back, looking for internal and external rotation. From there, we're going to go ahead and move on to the spine. I'm going to ask you to stand, and then I'm going to be at sitting down position. I'm going to ask for you, I'm going to inspect the spine, look at any curvation for scoliosis, lordosis, or kyphosis. I'm going to ask you to touch your toes if you can. And I'm going to look at the curvation in your spine to feel for symmetry or look for any abnormalities, which I don't see any. Okay, we're going to test your coordination. I'm going to have you put your hands out and close your eyes, and you're going to touch your nose with your hand, with your finger. Okay, and it was both done symmetrically. I'm going to have take a look at your gait and your balance. You're going to walk that way. And I'm looking for any limping, any asymmetry, any wobbling, uneven, steady gait, which you have none of those. Okay, you can sit back down. I'm going to test for any of the strength in your wrist and in your arms. You're going to push against me. Okay, and now the opposite way. Very good. And behind here. And in front. Very good. You're going to squeeze my hands for the strength. Very good. I'm going to check your hands and your joints for any deformalities. Do you have any pain in your joints? Okay, we're going to test now for carpal tunnel syndrome. I'm going to press here, and I'm going to tap on your medial nerve, and you're going to let me know if you have any tingling sensations.
No.
Okay, and that's the Tinel sign. If she would have had pain, it would have been a positive sign, meaning she would have had some carpal tunnel. Anything here?
No.
Okay, and we're going to do the Fallon's test. You're going to put your hands here. You're going to press for 30 to 40 seconds and let me know if you have any tingling.
Anything? Okay. I'm gonna press on your medial nerve for 30 to 60 seconds. You're gonna let me know if you have any tingling sensations in your hands.
No.
Okay, we're gonna go over some of the reflexes. The first one is called graphesthesia, and I'm gonna have you close your eyes, and I'm gonna write numbers on your hands, and you're gonna let me know what numbers they are.
2,
Mm-hmm.
1,
Okay.
3,
Yep. Now with your other hand.
4,
Yep.
6,
Yep.
9.
Okay, very good. Another reflex we're gonna test for. You're gonna continue to keep your eyes closed, and it's called the sterognosis one. You're gonna close your eyes, and I'm gonna put something in your hand. You're gonna guess what it is. Okay.
A key.
Correct. Next.
Cotton ball.
Correct. And with your other hand.
A coin.
Correct.
Pen.
Yes. Okay, Sarah, so we're going to continue with the reflexes on your biceps, triceps, and patella. Okay. And relax your hand. Okay. We're going to do your triceps. You're going to relax your hand. Okay. Now this one. Okay. So now we're going to do your patella. Thank you. Okay, very good. Okay, very good. So now I'm going to have you lay down so we can assess the range of motion in your hips and in your knees. Okay, so I'm going to first take a look at your knees and make sure that I don't see any deformities in your knees, any bulging in the joints. Do you have any pain in your joints?
No.
Okay, so I'm going to flex your knee. And let me know if you have any problems extending the
No.
flexation of the knee. Okay, now I'm going to go ahead and flex your leg to assess for the hip for external and internal rotation. Any problems with that?
No.
Okay. Do it here on this side for internal and external rotation. Any pain in doing that?
No.
Okay, so that concludes this part of the assessment, and we'll continue.
Hi, Ramanda. My name is Sarah. I'm going to be finishing up the assessment today. I just finished washing my hands, so I'm going to start with a thoracic examination. So I'm just going to take a look at you, and I'm going to note your rate, rhythm, and effort of your breathing. I see that you're not labored in your breathing. You're not breathing very fast, but you're not breathing too slow. So it's a normal rate and rhythm. I see you're not using any accessory muscles to breathe, and you're not leaning forward in the tripod position, struggling to breathe. I'm also noting your lips. I don't see any cyanosis. I'm going to take a look at your hands. I'm looking at your fingernails. I don't see any cyanosis in your nails. And I'm going to note clubbing, if you could go like this. I do see a window there, so there's an absence of clubbing. Now I'm going to palpate the back of your thoracic cage to do the thoracic expansion. Okay, so I'm going to put my hands on your back about 2 inches apart, right where your rib cage ends. I'm going to ask you to take a deep breath and let it out. Okay. So when you take a deep breath, I'm noting that my thumbs don't move very far away from each other as you take a breath and let it out. That's normal. It should be a minimal amount of movement of my thumbs. And now I'm going to test for fremitus. So I'm going to place my palms on your chest and back, and I'm going to ask you to say the number 99.
99, 99, 99, 99.
Okay, good. Now I'm just going to go to the back. And what I'm doing here is I'm comparing vibrations in the left and right side of your back. Again.
99, 99, 99, 99.
Okay, and I feel minimal vibrations and it feels symmetric on the left and right side of your back. Now I'm going to percuss your back. You can just lean a little forward for me. I'm going to start at the top and I'm going to move my way down the left side, noting tympani, turning to dullness when you reach the diaphragm. I'm going to make a mark on your back with my pen here. I'm going to ask you to take a deep breath. And I'm going to continue down until it turns dull again. Okay, you can breathe again and make another mark. Now I'm going to do the same thing on the right side. Breathe normal for a couple respirations. And I'll start. Again, just noting the tympani moving to dull when you reach the diaphragm. Make a mark. Okay, now I'm going to ask you to breathe in and hold it. Again, breathe normal, marking where tympani turns to dull. Now I have these 2 marks on either side of her back, so I'm just going to measure it here. And I got 4 centimeters on the left side and 4 centimeters on the right. Usually thoracic expansion is between 3 and 5 centimeters unless you're an athlete and you dive and you hold your breath for long periods. It might be greater than 5 centimeters, but yours is 4, so it's within normal limits. Now I'm going to auscultate your lungs in the back. I'm going to ask you to breathe normally with your mouth open, please. Okay. All your lung fields sound clear with no abnormal or adventitious lung sounds. Now I'm going to do a breast assessment. So I'm just going to look at your breasts to make sure they're the same. They're symmetrical, they're the same size. I'm going to have you raise both hands above your head. I'm looking to see if one breast elevates more than the other, which they don't. They're both the same elevation. Go ahead and put your hands on your hips and flex your elbows forward. And when she does this, I'm looking for any dimpling or indentation, which is absent, so that's good. Now I'm going to move on with your cardiac assessment. So I'm going to have you lay down on the bed for me. I'm going to remove this pillow. Okay, the bed should be 30 to 45 degree angle. And I'm going to assess her carotid arteries. I'm just going to inspect for any kind of pulsations. And I'm going to have you turn your head to the left, noting any pulsations. And I don't see any, so I'm going to go ahead and palpate for a bounding pulse, which is absent. And on the left, it's also absent. And now I'm going to go ahead and auscultate for bruits. And we do this using the bell of our diaphragm or our stethoscope. Okay, and I don't hear any whooshing of a bruit. Now I'm going to go ahead and palpate for your apical pulse. So the way we find your apical pulse is going to be on your right side mid-clavicular line. Left mid-clavicular. And it's going to be in your 5th intercostal space. So we're going to start at 2, 3, 4, and 5. So I'm going to palpate for any strong bounding pulses. And I don't feel any. Feels normal. And I'm gonna auscultate. Aortic. Pulmonary. Herbs. Tricuspid. And mitral. And I'm hearing a very clear S1, S2. I'm going to have you roll into your left side so I can auscultate for murmurs. And we're going to listen to the apex. And again, I hear a very clear S1, S2. Now I'm going to do a peripheral vascular exam. So I'm going to inspect your lower extremities. And I'm going to note their symmetry and size. They have the same temperature. The color is the same. I'm going to palpate for edema. So I'm just going to push on her ankles and shins, noting there is no edema present. Now I'm going to palpate your dorsalis pedis pulses, which is +2 bilaterally, and your posterior tibial pulses, which are also +2 normal pulse bilaterally. So I'm going to go move on from peripheral vascular to the abdominal assessment. So I'm just going to lift your gown up. Okay. Thank you. Sorry. Okay, so first I'm just going to take a general look at your abdomen, noting for any pulsations or lumps or asymmetry, which is, there is none. Her abdomen is symmetrical, and I don't see any pulses. So next I am going to auscultate the 4 quadrants. And I'm listening for bowel sounds. I should hear tinkling in all 4, which I do. Tinkling in all 4 quadrants. Now I'm going to listen in the middle for a bruit. And I'm not hearing any kind of whooshing. Now I'm going to percuss your abdomen, and this is just to assess for any kind of tympany versus dullness. And it sounds tympanic throughout. And I'm going to go ahead and palpate your abdomen for any tenderness, okay? So let me know if anything hurts. Does this hurt? This. And I'm going to press on her bladder for any kind of bladder retention that would hurt if she was retaining urine. And I'm gonna percuss again for the liver. So I'm gonna start at the bottom and move up. And when the tympanic turns dull, that's where I reach the edge of the liver. I'm gonna make a little mark. And I'm going to move from the lung down to the liver. Again, noting when the tympany turns dull again. Okay, I measure that, and that should be around 7 centimeters where your liver is on the left side. Now I'm going to palpate for the edge of the liver. So I'm going to put my hand under her right upper quadrant, and I'm going to press up, while with my right hand I'm going to press down, and I'm going to push my fingertips up as she takes a deep breath. So go ahead and take a deep breath and let it out. And I should feel the liver slide beneath my fingertips as she exhales, and then I can note any nodules or the texture of the liver. Okay. Now I'm going to palpate for your kidneys. So I'm going to do the same thing with my left hand. I'm going to put it under your upper right quadrant. And I'm going to press down deeply with my right hand while you take a deep breath, okay? Go ahead. And then push up, let it out. And as she exhales, I will release pressure, and I should feel the kidney. Well, in a normal assessment, you shouldn't feel the kidney, but if there was some kind of abnormality, you would feel the kidney slide back up into place. So I'm going to step around the bed and palpate for her left kidney. I'm going to put my right hand under her left upper quadrant. Go ahead and take a deep breath. Let it out. Okay. And I didn't feel the kidney again. But that's a good sign. That means your kidneys aren't swollen. Any tenderness when I did that? Okay. So this concludes our assessment. I'm going to step out of the room and let you get dressed, and I'll come back with any questions you may have. And I'm going to wash my hands.